hope everybody can listen. Keep your audio on. So let's start. In last lecture, we have seen the general exam till the general examination or the basic things which we cover in case history. So now the some things which are special in authentic history. We have seen about physics. What types of physics are there? Can anybody tell? Anybody? It's on your screen. Ectomorph, mesomorph, and endomorph. Ectomorph will be tall and thin, and endomorph will be a obese person. Then coming to the extraoral examination, first we have seen examination of head. There is something called as cephalic index. What is a cephalic index? It is measurement or the index of head shape. That means length and width. According to the length and width, the cephalic index head is divided like brachiocephalic, mesocephalic, and dolichocephalic. Dolichocephalic is long and narrow head. That means length is more than the width. Mesocephalic is equal width and length, and brachiocephalic is width is more than the length. How this cephalic index is derived? So cephalic index is 100 into width of head by divided by length of head. So if your this analysis, this sum gets the number of 70, that means it is dolichocephalic phase. If it is between 70 to 74, 74.9, it is again it is dolichocephalic. Below 70 is there is abnormally long or long and narrow head shape is there. Between 75 to 79.9, it is mesocephalic. That means in normal range. Between 80 to 84, the broader head, it is brachiocephalic. Above 84, it is more broader head. How we can connect this with the malocclusion. If patient is having broad head, it is very likely to uh, see the broader arches in these types of head. Then the facial form. Just like here, cephalic index, there is a facial index. How this facial index is derived? Again, facial index is what? Will measure height of the face and the width of the face. How height of the face? From the nasion, see on the PPT, from the nasion point to the chin point. This is height of the face. Width of face will measure from bizygomatic width. Bizygomatic width is width of face. So, likewise, like in cephalic index 100 into width by length. Here in facial index, there will be 100 into length of face by width of face. Okay. So, this range you can find it in your books also. According to this index, face is divided in uroprosophic, mesoprosophic, and leptoprosophic. Leptoprosophic is long and narrow. Width is lesser than the length. Length is more. That means height of face is more in leptoprosophic. Mostly, this leptoprosophic person will have a dolichocephalic head and a narrow arch and crowded arch. Got it? So anybody can anybody tell what uroprosophic person will be having? Like what type of head and what type of arch? Anybody?
Big broad face.
Okay, fine. May I know your name?
Me.
Was it Rajni?
Yes, ma'am.
Okay, it is correct, Rajni. A uroprosophic person, facial type of person will be having a broad head. That means a brachiocephalic head and a broad arch. Fine. And the next, facial symmetry. We have seen in the last lecture. Facial symmetry, gross asymmetrical face will notice. Then about the main thing, the most important thing will be facial profile. How you will assess the facial profile? Any guess? How to know that this person is having convex profile? From which side you will see, or from which side you will assess the patient?
Lateral side.
Lateral
Yes,
side.
fine, good, good. You will make patient to sit erect on the chair. Patient will not take the backrest. Fine. So in this posture, you will observe the patient from the lateral side. Then there are three profiles, which are they? Convex, straight, and concave. Fine. So when you will observe a convex profile, what is a profile? A line which is passing from the forehead to chin. Okay, the angulation of this line will determine the profile of the patient. Like in first diagram, here we can see the line is in convex shape till subnasal. This is a subnasal point. That means below the nose, subnasal point. And then it is going backward from subnasal to the chin point. This is a convex profile. In which type of malocclusion will see the convex profile? Can you guess?
Class 1.
Are you sure? See, what is class 1? Skeletal class 1 and skeletal class 2 and skeletal class 3. Fine. Skeletal class 1 where your maxilla and mandible is nearly at the equal plane. Normally, your maxilla will be 2 to 3 mm above or forward to the mandible. In these cases, in skeletal 1, we will get a straight profile. Most of the skeletal class 1 will show you straight profile. Here, when your upper arch, the maxilla is protruded, the forwardly placed, right? In these cases, you will find the convex profile. That means in which cases you will find protruded maxilla or forwardly placed maxilla? When your upper incisors
Class
are,
Class
3.
2, mother.
Class 2.
yes, it is class 2. Class 2 is what? When your upper arch is forwardly placed or proclined, like this. This is class 2. And what is class 3? When your lower arch is proclined or forwardly placed. Fine. In class 2 patients, you will see a convex profile because in class 2 patients, there will be retarded growth of mandible or retruded mandible and forwardly placed maxilla. Okay. Then straight profile in skeletal class 1 and which is the other malocclusion which will show a skeletal, oh sorry, which will show a straight profile. Any idea? In those malocclusion where your upper incisors are not proclined. Fine. Can anybody tell? Do you know about class 2 div 1 and class
H2H.
2? Okay, fine. H2 is fine answer. Do you know about class 2 div 1 and class 2 div 2?
No.
Okay. Uh, class 2 div 1 is where your maxilla is prognathic and upper incisors are proclined. There will be increased jet. That means there will be more overjet than the normal. This is class 2 div 1. What is div 2? Div 2 is exactly opposite to the div 1. In div 1, you have proclined upper incisors, but in div 2, you will be having retruded central incisors and proclined lateral incisors. This This my narration is very funny, but still I don't have any other method to explain that. In due to your central incisors will be retruded and lateral incisors will be proclined. In these cases, because of the pressure of central incisor, this central incisor will not allow your mandible to move forward. In these cases, your profile will be the patient will show a straight profile. Fine. So this is about straight profile. Straight profile you will see in skeletal class 1 and
Class 2 due to.
yes, fine, class 2 due to. Now the concave profile. What is concave profile? It is a saucer-like profile. You know, बशी माहिती आहे आपल्याला. So it is concave surface. So same like that. When you will draw a line from forehead to chin, it will show a concave angle. In class 3 profiles or where the patient is having protruded chin, patient will be having a class 1 molar relation, a class skeletal, class 1 molar relation and class 1 malocclusion, but still patient is having a protruded chin. In these cases also, you will see a concave profile. Concave profile will be associated with prominent chin and class 3 malocclusions. So convex will be for class 2 or proclined maxilla. Straight will be for skeletal 1, class 1 and uh, class 2 div 1 and concave will be for for class 3 where your mandible is prominent or mandible is prognathic. Right. Now facial divergence. How you will check the facial divergence? There will a line which is passing from forehead to chin. If the patient's mandible is retruded, that means patient is having class 2 malocclusion. Okay, so this line will diverge anteriorly. Okay, this line, this will tilt anteriorly. This line will not be straight because your maxilla is forward and mandible is retruded. This is anterior divergence. This is straight, where your upper and lower base are nearly to equal proportions. In class 3, where your chin will be or lower arch will be forwardly placed. So this line will be tilting the posterior side. Okay, this is posterior divergence. Understood? Anterior divergence, straight and posterior divergence. In these assessing the profile and facial divergence, I'm repeatedly saying that a line is passing from forehead to chin. In clinic, you will not have to, actually you are not drawing a line from chin to forehead. Okay. By visual observation, you are assessing all these things. Or else you will take a probe or take a scale and you will keep on the lateral aspect of the patient's face. Fine, you are not drawing the line. Then assessment of anterior posterior jaw relations. So it is also called as two finger test. This was a SAQ question for you for I think in last to last exam, university exam. Two finger test. What is a two finger test? This test is performed to assess the anteroposterior jaw relations. How you will do this? By your pointer and middle finger, these two fingers. Normally, your upper jaw will be 2 mm forward to the lower jaw. So, in skeletal class 1, where the profile is straight, your two fingers will be at equal directions. Okay. They will be proportional, parallel to each other. Okay. Your tip of these fingers will be pointing towards the face. Understood? Everybody?
Yes.
Okay, fine. So, what will happen in class 2 skeletal pattern? In class 2 skeletal pattern, your upper arch will be forwardly placed or there will be proclination of upper incisors. So, this, your fingers will be pointing and lower arch, that mandible will be retrograde. So these two fingers will be pointing upward. Okay, to adjust the upper proclination and lower retrusion. In class 3, the lower arch will be forwardly placed. So your fingers will be pointing downwards. Understood, everybody?
Yes.
Yes, ma'am. Yes, ma'am.
So your fingers will be pointing upwards in which class? Which class of malocclusion?
Class 2.
Class 2. Why?
Because maxilla is forward. मतलब
Okay.
आगे.
Okay. Maxilla is forwardly placed, so protruding maxilla is there and retruding mandible is there. Fine. So the next thing will be assessment of vertical skeletal relationship. So what is vertical skeletal relationship? So there is an assignment for you all. What is golden proportions? Everybody please note down what is golden proportions. In next class, we will be going to tell me what is golden proportions. So it go Google or search any books, know about what is golden proportion. It should be concerning with the face. Fine. अगदी scientific language मध्ये नाही सांगता आलं तर at least you should know what are golden proportions. Fine. Everybody, fine.
Yes, ma'am. Yes,
Okay.
ma'am.
Yes,
Okay.
ma'am.
Have you written that?
Yes, ma'am.
हम समझ
Yes, ma'am.
What are golden proportions? So assessment of vertical skeletal relationship. Vertical skeletal, that means upper and lower base, that is maxilla and mandible. So there will be an imaginary line, or you will use a scale and a probe, a mirror and a probe. So one line will be passing from the maxillary base, that means maxillary plane, upper arch, this line, and one line will be passing tangent to the lower arch, the mandible, the ramus of the mandible, like this. You can place a scale and probe or mouth mirror probe like this on the patient's face. If it is nearly parallel to each other, if you are, it is nearly parallel to each other, it will be a reduced, okay, like this. If it is more, the angle is more, it will be increased. What does this indicates? This will indicate the lower facial height. If the lower facial height is more, this angle will be more. Fine. If the lower facial height is lesser, the angle will reduce. What is this lower facial height? Anybody can tell? What is lower facial height? Okay, fine. This is concerned with rotations of mandible or the placement of mandible. If mandible is anteriorly forward and backward, mandible is in forward and backward position, it will increase the facial height, lower facial height. So in increased lower facial height, this angle will be more when the patient is having deep bite or mandible has upward rotation, okay, or deep bite. In these cases, this angle will be reduced. When the patient is having normal overjet and overbite, it will be a average or near to normal. Now, this is something related with the golden proportions. A face is divided in equal thirds or equal fifths. If you see this vertical line, 1/5, 1/5, 1/5. Okay, so the width of the average dimensions of your whole face. So all these part will be 1/5 of the average dimensions of your face vertically. In same like horizontal, a line which is passing from trichon, then the glabella, then subnasally, and then ventral. These equal, these will be equal parts of all the dimensions of the face. Likewise, this height from trachyon to glabella, it will be 1/3 of whole this length. Understood? Understood?
Yes.
And this, all these 1/3 will be equal to each other. That means the distance between trachyon and glabella will be equal to glabella to किती वेळ आहे? 3 minutes. Okay, thank you. So the distance between trachyon to glabella will be equal to the glabella to the subnasal distance. And if you individually think of this trachyon to glabella, this distance will be 1/3 of the length of whole the face. Fine. The lower arch, the subnasally to mention, this 1/3 is again divided from the upper lip to the subnasally. This distance will be 1/3 of lower face. This is a bit complicated to understand, but still the simple thing, just remember that our face is divided by 4 lines horizontally. These 4 lines will be trachyon, glabella, subnasally and menton. They will divide a face in 3 equal halves or 3 equal thirds, 1/3, 1/3 and 1/3. And these 1/3s are dimensionally equal to each other. Fine. And they will uh, be 1/3 of whole the face. Individually, if you are taking one part, it will be equal to the or equal to the 1/3 of whole the face. I hope you do understand this. Now, next, examination of lip. So, orthodontically, we are concerned about competent, incompetent, potentially competent, and everted lips. What are competent lips? What are competent lips?
Both upper and lower lip is joined.
That means there is a normal lip sit at rest. Okay. See, the first diagram, this upper and lower lips are closed. They are with contact. They are in contact with each other. That is competent lips. Incompetent, when there are lots of things which will show this feature in patient. That means if your upper incisors are proclined, they will not allow upper and lower lips to join. Okay. So if upper lip length, that means length from subnasally to the this border, upper border of lip, this is shorter. So in these cases also there will be no lip seal. Then potentially incompetent. What is potentially incompetent? Incompetent and potentially incompetent. Potentially incompetent, that means patient is having uh, at rest, patient is not having lip seal or lip contacts, but patient intentionally it will close the lip to make the contact. Lot if you have seen clinically, the patient will exhibit, they will forcefully close the lips, mostly in proclined upper incisors, because the patient will feel the proclination or the visibility of the incisors are more, it is not looking good. So the patient will try forcefully to close the lips. Okay, but when at rest, the lips will be apart. Then the everted lips. Everted lips, they will have, patients will be having short upper lip length, and the upper lip will be everted upward. So this is examination of lip. According to the time schedule, we'll have to stop here. But till the next class, please, uh, I have given the assignment what are golden proportion. For next class, you should know what are the golden proportions. Fine. Thank you.